bicolor cytosol is occasional use. So if you look at it from an mHealth standpoint, again, you'll notice about 38% that have bumped into occasional or frequent use. You have 62% that are in the no use category. And of that, the good news is 44% declare awareness of mHealth. If you look at it again, the numbers itself are not too bad at all, because the percentages that have moved into occasional or frequent use are quite similar to sports or even shopping. So that's quite striking. Then the next, one of the interesting questions that we had in there was this idea of channel preference. People normally ask this question of what do people prefer? My sense is this is a very coarse question, perhaps not a very sensible one. Nonetheless, we asked it. The reason we asked it, and we got what we expected, that people prefer the doctor in an overwhelming majority. You have a mean value of 2.36, a smaller number meaning greater preference for doctors. But we decided to dig deeper into this question, and that was, do people prefer mHealth as a substitute to doctor visits, or are they open to the idea of using it as a complement to doctor visits, where you augment a doctor visit with mHealth? And this is very interesting. You notice that 47% are actually open to the idea of using mHealth as a substitute to doctor visits, for certain activities, of course. And 67% are open to the idea of augmentation, of favorable, not just open, favorable to the idea of augmentation. We looked at two sets of predictors to understand adoption as well as channel preference. First were health-related predictors, and we looked at healthiness. People generally, how healthy are they? In our sample, about 79% of the people reported that they were healthy. But what was also very interesting was 61% reported that they felt within 3 to 5 years they would come down with a chronic disease. So the second set of predictors that we focused on from the standpoint of our study, and we controlled for the other things, was innovativeness with mobile services. And we measured this in two ways. One was self-report. How innovative do you think you are with mobile IT services? And we got a mean value of 4.18 with some reasonable standard deviation around it. Then the second thing what we did was we used a different measurement technique, which I won't get into the technical details, but it really comes to a computation based on if you are using something that other people are not using as much, you get a higher score. And these two measures correlate very strongly, and we use it both ways. Our results are consistent. The interesting findings. So from an intention to use mHealth standpoint, we find a whopping main effect of high IT innovativeness, meaning people who are just more innovative with mobile services are much more likely to report higher intentions. But what's very interesting here is the intention becomes stronger for those who are more vulnerable or more healthy, not sick. So this is quite interesting, and this is a consistent pattern that we see for frequency, exactly the same pattern, more innovative, enhanced by if they feel vulnerable or if they're healthy. Same thing for whether they're willing to use it as a substitute or a complement in doctor visits. This was a surprising finding to us, and I think a key message of this is that the target group, of course, are people who are innovative. They're much more likely to respond to the mobile health innovations services much better than others. But also, it's not likely going to be the people who are already quite sick. It's going to be those that feel they're vulnerable but are still healthy. And I think that's a very, very interesting message. When I say healthy, at least they're healthier. So the wrap-up of this presentation, mHealth diffusion, 38% have initiated use, 19% at regular use today. Preference, no surprise, much stronger preference for doctor visits. Surprise, 47% favorable to mHealth as a substitute, 67% favorable to mHealth as a complement, augmentation of doctor visits. And the channel adoption preference, it's promoted by IT innovativeness, reinforced by health vulnerability and state of healthiness. Practical implications is it's very important to develop meaningful onboarding and progression strategies for mHealth services based on the three factors that we've identified. And it is a much more effective strategy in our approach than focusing on coarse demographics such as age and gender, which tends to be the typical mindset when people are thinking about innovativeness and innovations. Thank you very much. Luduswamy, professor at IIT.
Thank you. Good morning. I have one core message which I'll articulate in the beginning and re-articulate at the end, and in between there'll be some slides and statistics. And the core message, in fact, picks up from where Arun left. I think we have been talking quite rightly about transformation quite yesterday and today. I think there's one important aspect, dimension of that transformation which needs a little more attention, which is the attitudinal transformation. With all the excellent work that's done by IT professionals, health professionals, policymakers, what ultimately matters is how it fares on the ground in the real society. How does society look at it? How do people accept? And these attitudes are shaped by social, historical, and cultural factors. And the enormity of that transformation is something we have to brace up to. And what we have done here is just a small slice to indicate the enormity of that task. And this paper was born out of a illuminating and provocative lecture by Professor Ganapathy in my course ICT and Development at IIT Madras. This study is basically about the awareness levels and attitudes towards mHealth in the institute, a premier technological institute, where the service has not yet been introduced as such, but what do people feel with regard to the prospects of its introduction. So it was based on a e-survey, including the students, faculty, and non-teaching staff. So these are some of the statistics about the cell phone usage patterns. The respondents-wise are 752 respondents, and most of them are students. And all of them except one, so that one, for one reason or the other, I know why, hasn't evolved into the Homo mobilicus. Otherwise, everyone had. And a substantial percentage had camera plus internet access, which is 235, and 91 students had video calling plus 3G facilities. And the kinds of features that were available, the kinds of cell phones they owned, did not differ radically according to the economic status. But what is important is the usage pattern. So most of them, given that most of the students use it for entertainment, that's apart from calling and SMS. So in fact, camera was used by 431. And apart from that, as entertainment, it was used by 287. And then next comes internet and then email. Healthcare was 13. Then this is the shocker. So how many of you have heard of mHealth before? This is in a premier institute of technology in a metropolitan city with students connected not only by cell phones but 24 hours internet. And only 171 were even aware of the concept of mHealth. But then the good news is, suppose if they are told about the various features of mHealth, what would be the acceptability levels? So in almost all of these, there was at least 70%. So getting health advice 24/7, sending medical data, using phone as a stethoscope, or drug information, etc., etc. But one aspect where it was not near 70% was video consultation, where it was less than 50%. So we'll come back to that in a while. But on the other hand, in response to the question, do you think that mobile phone is a viable healthcare delivery? More than 60% said yes. And assuming cost-effective mobile health technology could provide good healthcare, would you be willing to use the mobile phone as much as possible rather than visiting the doctor? Yes, but not that much, just about 52%. And the level of this acceptance we noticed was not in any way substantially related to the economic status. So it was not more about the cost effectiveness, but about the attitudes, so what was interesting was the reasons why they wouldn't want to use mHealth. The top candidates would always like to meet the doctor personally. So 527 gave that as the reason. And there was a perception also that such kind of a diagnosis would work better for minor diseases. Then some others said, 333 said, I need to know more about mHealth. Others said they wanted to know more about the cost aspect of it. And some said they don't trust the camera or any other functionality. And there were 19 of them who said, I am just against this, I don't know why. And the important thing here about the survey as such, I think, as you would have realized, it's very small and very limited. But what really matters is we need to do more of such studies, need analysis, before we go into the actual theater of operation. I think 3 A's have been particularly mentioned yesterday and today, which is availability, accessibility, and affordability. I just want to insist that there are 2 more A's on which we have to concentrate, which is awareness and attitude. So I think this is something which needs a lot of input from social scientists, humanities specialists, NGOs, management specialists, and others of this kind. And my last request and message is that as the conference itself